Well, knowing how to properly hydrate, especially for athletes and those who regularly work out, I mean, it's really crucial for muscle recovery and ultimately for refueling.
We become dehydrated from things like exposure to heat and sweating. While water is a common and key source for hydration, there are some other important factors to keep in mind as well. NBC News medical analyst Dr. Vin Gupta joins us now. Hey, Dr. Gupta, good to see you. So drinking water, is that enough to keep us hydrated? A lot of times people want to add in sports drinks and supplements. And also, how much water do we need to be drinking daily?
Yeah, Vicky, these are critical questions here. I would say it's not just water. Skim milk is actually the most hydrating fluid that you can drink. And a lot of people don't realize that. Coconut water is an option as well. Water-filled fruits and vegetables is also something that you can look to. So things like grapes, for example, or tomatoes, chock full of water will get you what you need. In terms of how much you need, I like to say just straight water intake, Vicky, it's about 3 to 4 refills of your water bottle, which holds about 2 cups. That's the straight water intake that you need. But in total, all the various sources, about 12 cups a day for men, about 16 for women.
We see all these powders, Dr. Gupta, and all the famous sports drinks that we're used to hearing that talk about electrolytes. What exactly are they and why are they important?
Electrolytes, Morgan, are things like sodium, potassium, these elements in our body that help our heart beat normally, all the electrical conduction system in our heart, for that to function properly, for, frankly, our cells in our body to rid itself of waste and to have nutrients to really function properly so that we can age and just have a healthy lifespan. So electrolytes are critical for the normal functioning of our organs. And these sports drinks and all their powders, when properly utilized from trusted resources, they can be helpful to keep you hydrated and give you these necessary electrolytes.
Dr. Gupta, what are some signs of dehydration? When do you need to worry that you're not getting enough fluid?
If you're clammy, Vicky, if you're feeling like you're going to pass out, those are signs of low blood pressure. So those are really critical here. If you have a weak pulse, that's something to keep in mind. If you're feeling fatigued, especially in, say, children or older adults, if you're feeling altered, if they're just not as alert as they normally are, that can be a sign of incipient dehydration. And that's where, especially in the setting of a high heat, potential heat stroke. So those are things to keep in mind.
Does that look differently, Dr. Gupta, depending on your age? Like, would it look differently in a baby than, for example, a full adult?
It could. So with babies, it could start as irritability, just feeling like, maybe, oh gosh, are they hungry? And then going towards diminished mentation and then getting to a place where you can't even wake them up. With adults, especially older adults aging in place, Morgan, what we typically see is they just become less alert. And so that there is a slight difference there, but basically less alertness is the worrisome sort of end stage finding.
Aging in place.
Aging
I don't
in
think
place. That's
I've
not a
ever
good term. I
heard
didn't like that. Yeah.
Oh, did that hit you different?
It
hit me
way.
a little funny. Not
Yeah.
aging in place. I got to sit and think
we gotta
about that,
move.
pray on that.
Right.
All right, Dr. Vin Gupta, thanks so much. We appreciate it.